Hello everyone, welcome to Physially. Today I'm going to explain lumbar canal stenosis. So what is this lumbar canal stenosis? Our spinal cord passes through a spinal canal, isn't it? So when there is a stenosis, that is a narrowing of the canal, it's called canal stenosis or spinal canal stenosis. Usually this spinal canal stenosis occurs in the lumbar region. So that's why it is called as lumbar canal stenosis. So let's go to the definition. Lumbar canal stenosis is a condition where there is a further narrowing of the anatomically narrower spinal canal. So the spinal canal is primarily narrower and now again we are furtherly narrowing it. So it mostly occurs in the lumbar region, lower lumbar region due to spinal stenosis. So occurs most commonly in the lower lumbar region. So this is the actual definition where lumbar canal stenosis is a cauda equina compression. What is cauda equina? The end part of the spinal cord is called as cauda equina, where the lumbar and sacral nerves comes as a horse tail, appears as a horse tail. So here the cauda equina is compressed, so in which the lateral and anterior-posterior diameter of the spinal cord is narrower with or without a change in the cross-sectional area. So here what does it tell? So lateral and anterior-posterior, lateral or anterior-posterior diameter of the spinal cord is narrow with or without change in the CSA cranial our cross sectional area will be normal or it will be decreased or changed, but the main thing here is the cauda equina is compressed. So classification, so there are different subclasses in the classification. First one is generalized or localized variety. So generalized, what does it generalized mean? In the lumbar region at different vertebral levels or segments there is a stenosis. Localized is at a single particular point. So let us assume it is at L3 L4 region, like that. So generalized means there are multiple compressions or there are multiple stenosis, and localized is only at a particular point, we can point it out. So second one is segmental. So segmental is central, lateral recess, foraminal and far out. So central lumbar canal stenosis or lateral recess lumbar canal stenosis, foraminal lumbar canal stenosis, far out lumbar canal stenosis. So here, so I am going to show you a pic. So here this is the thing. So what does it tell here? So here we see that the spinal canal, there is a stenosis. So here this is a normal spinal canal. So here we see that there is a stenosis, there is a compression of the or narrowing of the spinal canal. So second one, here we saw different types, right? So what is the first one? Central canal stenosis. This is a central canal stenosis where the centrally the spinal canal is a becoming narrowed. And second one, here we go, is lateral recess stenosis. This is a lateral recess stenosis where the spinal canal is becoming narrower in the lateral sides, in the lateral ways. Next one is foraminal. The foramen is a becoming narrower. And far out is, what is far out? Far out is outside the outside the canal. So this is what about the segmental lumbar canal stenosis. Anatomical area, it might occur in the cervical, thoracic and lumbar. Cervical is seen, sometimes we see cervical canal stenosis also, and thoracic is very rare, and lumbar we most commonly see in the lumbar region. Next comes our pathological classification. This pathological classification is a basic kind of, if you write these things like generalized, segmental, anatomical or not, you have to write this pathological for sure. So what is pathological classification? That is Arnold's classification. It has only two subclasses, that is congenital and acquired. What is congenital? There is a laminar thickening of the developmental origin or congenital achondroplastic grafts. So it tells that, so in the congenital, what does congenital means? By birth. By birth, there is a laminar thickening. It might be due to developmental origin or it might be at birth by itself. So example is achondroplastic grafts. So I am going to show you a pic of achondroplastic grafts. This is achondroplastic graft picture. So if you see this boy's or person's picture, here you see he is having lordosis. This lordosis is leading to the decreased canal space or stenosis of the canal. So most of the congenital causes this achondroplastic graft. And next is Acquired is after birth you are getting this. What are they? So degenerative diseases of the disc, it might be. So even if the disc bulge is there, even the disc bulge will be resulting in the compression of the or stenosis of the canal. So next one is iatrogenic. So iatrogenic is any invasive methods. And next spondylitis and spondylolisthesis, post-traumatic osteophyte formation and changes in the vertebra. Other causes there might be Paget's disease, fluorosis and fracture of the spine, kyphosis, scoliosis and dish. What does dish mean? Dish is nothing but, so here we have dish syndrome, something called as dish syndrome. Dish is diffuse idiopathic skeletal hyperosteosis. So diffused idiopathic skeletal hyperosteosis. So there will be bone, the extra bone formation. And next may develop following spinal fusion and laminectomy. So the acquired spinal canal stenosis might be because of these reasons. Okay. Next, coming to the clinical features, usually the lumbar canal, as per the definition only, here we said that cauda equina compression. So obviously there will be cauda equina related symptoms or their clinical features. So symptoms develop insidiously, so they are not sudden, they are insidious. Slowly the patient develops the symptoms, and the patient presents low backache which diffuse the radiation into the both the gluteal regions and the back of the thigh. So the patient will be having low backache. One of the main cause for low backache is this lumbar canal stenosis. So the patient complains with low backache, the pain will be radiating to the both the glutes and it will be traveling through the back of the thigh. The patient presents with symptoms of intermittent claudication. What is claudication? It's a stopping of the blood, right? So next, here the patient will be having blood or anything. So next, pain, heaviness, paresthesia. Pain is, heaviness is also, and paresthesia is decreased tingling and numbness and tingling sensation after walking for certain distance, and hyposthesia also may be seen. So pain is a neurogenetic claudication. Pain relieved by sitting or lying and increased by standing or walking. So the pain, when does the pain will be increased? It will be increased when you sit or stand, or it will be increased when you stand or walk, and it will be relieved when you sit or lie. Okay.